I feel like I'm going up against this giant.
Rushed to the ER to receive life-saving care.
I was just trusting that they were, giving me the care that I needed.
Care that's now costing this Coloradan more than $100,000. Despite a state law to protect patients, Denver7 Investigates found, for some, the surprise medical bills keep coming.
It's honestly, it's made me physically ill.
And he's not alone.
I thought maybe our insurance benefits had run out.
A billing mix-up cost this family $1,500.
People should be aware of how medical fees are being charged.
Despite a promise from the insurance company for coverage, this mother still can't get answers. And she has a warning for you.
Plus, both directions of I-70 are back open after this mudslide in Glenwood Canyon. But concern lingers as more rain moves in.
Two Coloradans fighting the same fight, both hit with surprise medical bills. And when we started asking questions, it turns out, in both cases, it was all a mix-up.
And tonight, they are sharing their story so you know when to start asking questions. Good evening, and thanks for watching Denver7 News at 10. I'm Ann Trujillo.
And I'm Shannon Ogden. We're glad you're with us tonight. We're going to start tonight with the story of a Colorado man who turned to Denver7 Investigates for help after going to the ER and coming out with a bill of more than $100,000.
Denver7 investigative reporter Jennifer Kovaleski is again looking into the cost of care.
I went to the emergency room.
When you have to go to the hospital,
They did an MRI. They found a lesion near my brain.
one of the last words you want to hear is your stay was out of network.
They're claiming that I voluntarily went to an out-of-network hospital, which is not true.
Even worse, getting a surprise bill for more than $100,000.
Total amount billed of $109,586.46.
That's exactly what happened to Charles Van Heck.
What does that mean for you?
It means I can't pay it. I'm waking up in the middle of the night thinking, how am I going to take care of this?
After going to Southland's ER in Aurora with a potential brain aneurysm, Van Heck says the doctor told him he needed to be transferred to University of Colorado Hospital to see a specialist. He went by ambulance, and when he got there, no one warned him there was a problem, until he got what looked like a bill from his insurance.
I think somebody should have come and told me before I was admitted. They should have given me the opportunity to say no.
I have an in-network hospital and an in-network surgeon, and the guy in between that's going to make me comfortable is out of network.
Denver7 Investigates first exposed how contract disputes between insurance companies and doctors are leaving patients caught in the middle, forced to pay these new unexpected, out-of-network costs. We did some digging and found that's not what happened in Van Heck's case.
What do you want done?
I just want them to resolve this.
Once we started asking questions, United Healthcare now says this wasn't an out-of-network issue after all. Instead, it says the hospital coded the bill wrong as a non-emergency.
Do you think it's right that this is how our healthcare system works?
I think when somebody's sick and they truly need medical care, they shouldn't have to worry about whether they can afford it or not.
United says it fixed the issue and reprocessed the claim, leaving Van Heck with a much more reasonable cost of care. I'm Denver7 investigative reporter Jennifer Kovaleski.
Let's take a deeper look at what the state's been doing to protect Coloradans. In early 2020, a Colorado law went into effect that would have prevented a Coloradan from receiving surprise medical bills. The law requires healthcare providers give a patient notice if they are seeking care from an out-of-network provider. For example, somebody seeking care at an in-network hospital, but the surgeon is out-of-network, that would bring the higher medical bill. But when we took a closer look at this, turns out this law only applies to state-regulated health insurance plans. And that Charles Van Heck you just met, he's not alone at all. Navigating the cost of care in our healthcare system is often confusing and frustrating.
A local mother reached out to us today saying a billing mix-up cost her teenage son more than $1,000. She still can't get a refund, so she contacted Denver7, and we sent Denver7 Sloan Dickey to get answers.
He called and said, I am really struggling.
During an emotionally difficult year in 2020, this mother tried to help her son who was beginning to experience anxiety.
We knew he was struggling and he needed support.
She asked to stay anonymous to protect her son's privacy, but says her son was referred to the University of Colorado Depression Center for online therapy sessions. She says the visits worked.
He's doing so much better. He's doing amazing.
Her insurance company, Anthem, told her that virtual visits with psychotherapists are covered by her healthcare plan.
I believe it was COVID related, the Anthem and my employer said, okay, if you need mental health visits, because a lot of people did during COVID, that we will cover it 100%.
But it came as a shock when her son started getting charged for the visits.
In October, we started getting bills for those visits.
She says the CU School of Medicine billed her insurance company for in-person visits that were not covered in her plan, even though all of her son's visits were online.
They were $144.67 a visit, and there was 11 visits that were billed incorrectly.
More than $1,500 in bills sent directly to her son.
He's 19, he's receiving all of these invoices for medical services, and he's like, I don't have the money to pay this.
She said she tried to fix the problem with the hospital.
I would guess it was a medical coding error, but resolving it with CU has been really difficult.
When we contacted Anthem, a representative said in a statement the claims were likely erroneously submitted and they need to be corrected before the billing can be fixed. A representative for CU Medicine declined to comment for the story.
I just want to emphasize that people should check if they're being billed by a medical provider, check to make sure that the bills are correct.
She says she's asked CU for months to change the billing to reflect the virtual visits, but hundreds of dollars in charges remain.
People should be aware of how medical fees are being charged and if they're being charged correctly.
The good news is her son is better, but her fight over the billing continues. Sloan Dickey, Denver 7.
And we took a deeper look at what you should do if this should happen to you. And the big thing is, don't be afraid to ask questions. And because Colorado law doesn't protect everyone or every situation, here's some things to keep in mind. Always check with your insurer to make sure that you are choosing a provider that will be covered, including the hospital, the lab, or healthcare facility. And if you have to have surgery, even if the facility is in network, check with that facility to make sure the surgeon, anesthesiologist, and surgical assistants are also in network. And in the case of an emergency, know where the nearest in-network ER is.
Colorado is on track to hit the president's goal of vaccinating 70% of American adults with at least one dose by July 4th. The latest numbers from our state health department show 69.51% of Coloradans 18 and older have gotten at least one shot. Now, overall, the country is just barely going to miss the president's goal. At the current pace, 68% of adults will be partially vaccinated by July 4th, according to the New York Times. 18 states hit that 70% mark.
Both directions of I-70 through Glenwood Canyon are back open tonight. Good thing. After this weekend's rain sent mud pouring through the Grizzly Creek fire burn scar area and right onto the interstate.
Denver7's Addie Guajardo joins us live from Glenwood Springs. And Addie, businesses are certainly happy the highway's back open, but worried this is going to happen again.
Ann and Shannon, they're worried because it doesn't take a lot of rain to trigger a mudslide in areas that have been ravaged by wildfires. Right now, I-70 eastbound is flowing smoothly. I spoke to several business owners earlier today, and it was a mix of responses. Some told me Saturday was extremely slow. Others tell me that those locals that live here and work here, and also the people that were stranded, really kept the business going. Now, for those who braved those detours, those were extremely long journeys. It typically takes about 2.5 hours to get from Denver to Glenwood Springs. Today, it took us more than 6 hours. Now, the heavy rain triggered 2 mudslides over the weekend and shut down I-70 eastbound and westbound between exit 116 and 133 through Glenwood Canyon. Both mudslides happened in the same place near No Name. The Grizzly Creek fire from last year created a burn scar that brought down soup-like debris, making it difficult to clean up. Scattered showers are expected throughout the week, and experts say they're working quickly to evaluate areas of concern where other mudslides may be triggered, but they say that all depends on the intensity of the rain and where it falls. Now, the general manager of Colorado Ranch House, a restaurant, tells me anytime I-70 is shut down, local businesses feel that impact.
A lot of the staff gets stuck on the wrong side of the mudslide, so we can't get them into the restaurant. Luckily, we were pretty blessed this weekend to not have that issue, but I know in the past couple of years ago, there was a really, really bad one out towards Newcastle, and there were some staff members stuck in Rifle, stuck in Newcastle, and they couldn't get into work, so that will impact your business because you can't open the whole restaurant.
Now, I also spoke with a family on vacation from Pennsylvania. They tell me they're a little bit nervous about their trip to Colorado Springs this week and hope those highways here on I-70 stay open. Now I'm going to send it out to our very own chief meteorologist, Mike Nelson. And Mike, we could be seeing mudslides like this for the next 5 to 10 years?
Until that area revegetates, it will be prone to rock and mudslides. And so the main headlines are more showers this week. You get locally heavy downpours, and you can get these mudslides and the burn scars. But it's also beneficial moisture. Here's how it looked today up in the mountains in time lapse. These showers come in fast, and they hit pretty hard. They don't last all that long. But again, if you have areas that have been burned off, it doesn't take much to make that slide. Right now, not much happening in that area. There are some showers down to the south, and there's still plenty of moisture across the state. We will see a return of afternoon showers and thunderstorms not only tomorrow, but for most of this week. Details coming up.
They've seen the violence firsthand.
I want to help make a change by encouraging others.
And tonight, several Colorado teenagers are on a mission to put youth violence to rest.
Plus, preserving a piece of Denver's history.
Protect your house, protect the place you live in, and protect the memories.
Hundreds of Denver homes could be designated as historic. The push to keep one community in touch with its roots and away from development.